Patients have a right to understand their care. Hi, my name is Angel Mathis. I am an RN, and I'm here to encourage the women that is in transition or in midlife crisis, or maybe struggling with issues in their body, and they're having trouble with addressing these particular issues with their physician, whether it's a family doctor or gynecologist, or even with your psychiatrist or whatever physician you see. I want you to be comfortable and I want you to be confident. You'd be surprised how so many people fear speaking to their doctor or fear the unknown because they don't know what questions to ask. And that's why I wanted to present this to you, because I understand that even, just going your day by day and being able to call your doctor, because now they have so many different ways of speaking with your physician. And a lot of people, God bless my women that's over 50, they don't always know how to use the email. Not everybody knows how to send a text. Not everybody, but there's some people that know how to use of course, the phone, but their technology has advanced so much. So I just wanted to share, just to be here for you, that patients, that you have a right to understand your care. And understanding it, you just have to know what questions to ask. Your voice matters in your care. It's important that you understand that. Don't let nobody fast talk you. Don't let nobody rush you. Don't let nobody ignore what you're trying to say. You let them, you speak and tell them, say, no, I don't mean, we don't have to be rude or nothing, but you can speak your mind and be confident, whether you're speaking for yourself or another loved one. You let them know that, hey, I have a question about this and that, because it's in these doctors' offices, you have a few doctors that really take their time when it comes to patient care, patients' questions. They address all of the patient's questions. They address all the patient's questions, and they answer everything. But there are some physicians and some healthcare providers, it's a rush. It's just an in and out thing. But I want you to take control of your healthcare and your healthcare journey. So if you may be dealing with something, some type of disease process issue in terms of your high blood pressure. You may be having issues with your blood pressure going up too high or too low. The top number is, for an example, your blood pressure may be 169/100. That's really high. The systolic number is the top. The diastolic is the bottom. You need to know what a normal blood pressure is. A normal blood pressure is 120/80. You may be having issues with sugar diabetes. You might not even know that, but you may feel faint. You may feel hungry a lot. Your urine may smell fruity. Even your breath may smell fruity. I need you to get that checked out, because sometimes if we're not careful, you may have diabetes. We call it the 3 Ps. Polyphagia, when you're eating a lot, you wonder, why are you eating so much? Why am I eating? Why am I eating? Polyuria, you urinate a lot. And polydipsia. So urinate, eat, and drink. Yeah, you just constantly drinking no matter what. And then a lot of people, if they don't catch their blood sugar, since we're on diabetes, there's tons of different types of diabetes. But the one I'm talking about is just a general diabetic, type 1, type 2. It still have similar symptoms that you may experience that you need to know about. So women, my sister, please get yourself checked out. Get the lab work. Get the blood draws. Get the blood draws. Get your pap smears, your annual pap smears. Get your annual breast exams. Some people don't have, you'd be surprised, and then be an undergird, be a teacher, be an educator for our younger women to be able to do those things. Go and get a pap smear, get a mammogram. You need to get checked out. Some people go to the doctor and don't know that they have a lot of things that's going on in their body. So my point is, I want to make sure that you're asking questions confidentially, in confidence, asking questions confidently, asking questions confidently. That's what I'm trying to say. I'm going to slow down a little bit. Ask questions confidently. Be strong. Give them eye-to-eye contact. Don't be all fidgety and stuff, and practice at home if you have to. Some of us are pretty bold and confident in who we are, and we're able to just speak our mind on this hurt, that hurt, how you going to fix me. But then there's some people really shy about asking particular questions. Some people I've taken care of some people, they end up, I don't make it be afraid. They have tumors. They die of cancer because they didn't want to tell anybody. You have your dignity, you have your free will to be able to, how can I say, make those decisions. You don't want to tell anybody. You want everybody to know your business. But I'm asking you to please, if you want help and need help, you have to ask your questions confidently. Be bold. Look them in the eye. Don't let them overtalk you or fast talk you. If you have to write it down on a tablet, say, hold on, doc, let me make sure. Or if you have to bring a loved one, like a daughter or a power of attorney, or somebody that's a power of attorney, a medical power of attorney, somebody that assists you with making medical decisions and concerns about your healthcare condition. So know your options. That's the other thing. I want to make sure that's number 2. Make sure you know your options. Understand what doctor you need to see. Because the family doctor can do so much. Many times the family doctor can refer you to a specialist. They don't do the urology, the kidney or nephrology system. They don't do that. So sometimes they refer you if you're having issues with your kidneys or your bladder that's way out of their scope. Their job is to send you to the specialist, and it's very important to understand that. You have some doctors back in the day, the family doctors, they treated mostly everything. Now we got a doctor for everything, a dermatologist, a skin doctor, that's a dermatologist. We have a oncologist, that's a cancer physician. We have a hematologist, that's a blood physician. We have so many physicians. And we also have what they call nurse practitioners and physician assistants. So I notice a lot of the doctors are moving into the realms of having a physician assistant and a nurse practitioner. It could be because they're so overwhelmed. There's so many sick people. Many times when I even go to the doctor, I love to go to talk to the nurse practitioner because I feel they have a little bit more patience than the doctor do. But just beware that there are options. If they say, well, I can't get you in till next week or whatever, that's fine. Just if you need to get it in urgent, they have urgent care systems, urgent care facilities. They have, of course, emergency room. They have the hospital. Just know your options. If you know it's a 911 and you can't get to the hospital, you dial 911. There are so many options that's available that you need to know about. So know your options. Number 3, advocacy empowers decisions. So when you are heard, it empowers you in your decision making. When you understand that you have more, that you understand that, how can I put this? When you know your strength and you're walking in it confident in confidence, there's nothing that they can get over on you. Like I said, some people, they have to write it down. Some people have to just ask the questions, but just understand, being an advocate like I am, it empowers my decision making, because an advocate can help and lead and guide, can help you understand what I'm not a physician. That's my disclaimer. I'm just the nurse, but I can't treat you. But just knowing those little symptoms of what this medication is for and what side effects is it, or what is my normal blood sugar run, those type of things. What is my normal blood pressure? Those type of things. Is this knot here, this sore here? Is that something significant? Why is my skin so red and itchy and scratchy? Who do I need to go to? I'm having a lot of female reproductive pain. What is going on in my private area, my private bits area? All those things. Women don't, be surprised how many women don't know the different things that they're going through regarding on what care that they can receive. So I wanted to really spend some more time. I'm going to spend more time. I'll break this up in sessions because there's so much I want to be able to give you all regarding your health care, because it's very important that you understand you need to know what's going on with your body. Like I said, you'd be surprised how so many people keep trucking along and ignore the symptoms, ignore the cough, ignore the hiccup, ignore a knot or a bruise. or no, ignore this chronic pain. Some things Tylenol doesn't always fix, or Epsom salt doesn't always fix. Sometimes you need to get in and see your doctor. There's nothing wrong with that. I just wanted to also mention that your voice matters in your care. You have to understand that your voice, it matters in your care. You have to understand it. Once you get that in your mind and just say it. Say, my voice, I can speak about my care. Because a lot of, I'm not saying everybody, but it's good to have someone that will be there for you, like your daughter or your son, that you can trust, that'll give you the right information, or have you ever just a good trusting physician that can really break that down to you. I just want to share that with you. You need to know all of that. So number one, ask questions confidently. Know your options. In advocacy, being heard empowers your decision making. So when you being heard, it empowers your decision making, whether you should go with this particular surgery, whether you should hold off, whether you should just try a second opinion or a third or fourth. Those types of things I wanted to mention. So let's bring clarity to your care journey. And like I said, I'm a Christian life coach, but I'm also an RN advocate. And I help women that's over 50 and above regarding their health care, their body, their medical condition. My disclaimer is that I'm not a physician, but I'm an RN. So I have a lot of experience dealing with different patients in different arenas, in the hospital, and intensive care, and telemetry, where they monitor the heart, in hospice, in home health. I have so much experience in there, and I want to be there for you. If you have any questions, feel free to reach out, and we will definitely pick this up again. Like I said, let's bring clarity to your care journey. God bless you. And also, let's live anchored. Amen. This program is part of my Live Anchored program. But I wanted to come on and talk about the healthcare component of it. And we'll talk to you next time.